The TIF is an acronym for transoral incisionless fundoplication. So from that name, you understand, number one, there is a fundoplication going on here. Fundoplication is a generic name for any procedure that is meant to tighten the gastroesophageal valve. In this case, transoral means we're going through the mouth with an endoscope. We're not making incisions, unlike the traditional laparoscopic Nissen fundoplication, which is the gold standard for reflux. And I said gold standard because, there are several reasons why it might not be the gold standard. Incisionless because we don't make incisions. So transoral incisionless fundoplication. It is an amazing concept. The idea is, how can we tighten the gastroesophageal valve, which is the reason why people have reflux when this valve doesn't function properly. How can we tighten it up without making an incision, thereby reducing the risk associated with the procedure, increasing the recovery, the efficacy of the procedure, and also reducing the recovery time. So what makes the ideal TIF candidate? Number one is the weight. Your weight has to be in such a way that your BMI is less than 35. So that means, we prefer you to be of normal weight or maybe overweight. If we start getting into the obese category, the TIF is not a good choice. Reason being, when we're overweight or we're obese, there's a lot of pressure from having excess fat within the abdomen, and that puts a lot of stress on the valve, and it can reduce the efficacy of the valve. Okay. The second criteria is one must not have a hiatal hernia, which is a situation where the diaphragm has a big hole in it, and also the stomach may be sliding up into the chest area, so the valve is not in the right position. So that in some cases, if the hiatal hernia is less than 3 centimeters, we can still consider TIF, but we prefer you not to have any hiatal hernia. The third criteria is not to have any complications of reflux, such as Barrett's esophagus, which is a situation where the esophagus, the esophageal cells have been so damaged by acid that they're now changing into precancerous conditions. So that is another risk factor. Other than that, it's a very, very safe option that we offer to patients that are as young as 18 and as old as 85, 89, 90, provided they are otherwise healthy.